The Politicrat is brought to you by the great people at Anchor. Anchor is such a great place to go if you want to get started in podcasting, and it's easy and it's free. Anchor, marvelous stuff, marvelous. And I'm so grateful to the folks at Anchor for getting me going with The Politicrat. If you want to get going and be heard on Apple, on Spotify, and everywhere podcasts can be, download the free Anchor app or go to anchor.fm to get started. Welcome to another edition of The Politicrat. I'm Omar Moore. It is Friday, May the 22nd, 2020. Today, I have a story for you. A story you may have heard before, but a story that needs to be told, and told, and told, and told. COVID-19 has taken so many lives all over the world. People have been killed as a result of this virus, died from this virus, a virus that has ravaged communities. And we hear about these communities here and there through the news media. But I don't think that we are told the deeper stories behind the numbers, and not just that, the structures, the institutions, and the institutional racism and the institutional neglect shown to Black, brown, Native American, Native Hawaiian, and Pacific Islander individuals who are disproportionately dying from this virus. And the numbers are so alarming. This is not a story that should make anyone comfortable. This is not a story that should ease your mind as we go into a Memorial Day holiday weekend here in the United States. Many of the deaths have not really been given the contextual ambit that they should. You have, in all of these cases, institutional neglect, governmental neglect, and willful governmental neglect and disregard of their lives. The Trump administration has shown complete and utter contempt for Black, brown, and Native life. What do we have to lose, Donald Trump? Our lives. And we are losing our lives in record numbers. We're losing them here at home in the United States, and we are losing them overseas, whether it is in the UK, whether it is in India, whether it is in other nations. Brazil has become a place where Black and brown people are dying in alarming numbers. Lives are being lost across the board. Certainly, there are white lives as well that have been lost. My focus is on the alarming, disproportionate numbers of black people, of brown people, who have perished from this virus here in the United States and also beyond. COVID-19 has now taken just about, as of this date, May the 22nd, 2020, in the United States, has taken just about 100,000 lives. Much of this death could have been prevented had Donald Trump cared an inkling about those lives. But Donald Trump cared only and does care only about himself and the money that he can make. And he also cares about trying to get back into the White House that he took in 2016. COVID-19 COVID-19 is the black and brown disease. COVID-19 is the black and brown genocide. This is happening right under our noses, right before our eyes in 2020. Many of the deaths are occurring in nursing homes. Rarely, however, are the races and ethnicities of the makeup of those nursing homes talked about in the press reports.
For 25 years, Maurice Dotson worked as a nurse's assistant at West Oaks Nursing Home in Austin, Texas, changing bedpans, diapers, sheets, and just being a friend to those elderly who no longer had any friends. That ended when he died on April 17th. The cause? COVID-19.
He wasn't given basic personal protective equipment, such as a mask.
Maurice Dotson was one of 111 cases of COVID-19 at this nursing home. The state sent in Texas National Guard soldiers to disinfect West Oaks and other facilities. Quentin Brogdon is attorney representing Dotson's family in a lawsuit, which says the nursing home failed to properly prepare, respond, and provide its employees with personal protection equipment as required.
He gave his life to care for the residents of West Oaks. They were his second family. He could have called in sick. He could have quit, but it just wasn't in his DNA. He protected them, but he wasn't protected.
West Oaks will not comment on the lawsuit, but in a statement, the company said our operations and protocols changed profoundly with the release of the CDC guidelines. Nursing homes and long-term care facilities from the start of this pandemic have been hotbeds of illness and death. One study shows 41% of coronavirus deaths in 36 states are connected to nursing homes. The virus spreads quickly to patients and staff who then leave work and spread it to others.
In this pandemic, if a worker is infected with COVID-19, then they can not only spread it to their coworkers, but they spread it out into the community.
A CNN review of hundreds of complaints to federal and state governments show that workers at long-term facilities feel their own lives are at risk, writing complaints like employees are not provided personal protective equipment such as masks, using coffee filters as masks, and garbage bags as gowns. Healthcare workers have died from the COVID-19, and the employer is unwilling to report it.
We have been begging for additional equipment in nursing homes for the last 2 months, and unfortunately, No one has listened. In some cases, we've had to go without it, and the results have been tragic.
Mark Parkinson, president of the American Healthcare Association, says in the rush to find protective gear for unprepared hospitals, nursing homes have been ignored.
Unfortunately, the resources that were denied to nursing homes and were sent to hospitals have had really tragic results because it's impossible to stop this virus if you don't have the face masks that you need to keep it from spreading.
It's like government malfeasance on how little they have done.
Deborah Berkowitz is former chief of staff at OSHA, the government agency charged with protecting workers. She says the government has failed by silently allowing nursing home deaths to multiply without acting.
OSHA put out no specific guidance to just recently and has no mandates. And guidance is voluntary. Employers can follow it or they can ignore it.
OSHA's guidelines on protecting nursing home workers during the COVID-19 pandemic were published only this past week, 3 months after the first deaths were recorded at a nursing facility in Washington. Far too late to help workers like Maurice Dodson.
He was 51 years old. He didn't need to die.
OSHA, the Occupational Safety and Health Administration, Wolf, tells us that investigates all complaints and has been paying particular attention for protections for those workers with high exposure to coronavirus, but that is of little comfort to the family of Maurice Dodson.
Of little comfort indeed to the family of Maurice Dodson, whom, as you heard there, had worked at a nursing facility in Texas for 25 years, half of his life. He died at the age of 51 just last month. May Maurice Dodson rest in peace. Welcome back to the Politicrat. The institutional failures, the governmental neglect, and the willful disregard by Donald Trump of the lives of many hundreds of thousands of people. The 40 years of neoliberal and libertarian policies have brought us to this particular moment in the United States, in the United Kingdom, in India, in Brazil, and beyond. The 4 countries with the biggest numbers of cases are the United States, India, Russia, and Brazil. All of those places with right-wing or authoritarian dictator figures. And when you extrapolate and look at that reality, you see that in the vast majority of those 4 countries, the populations of black people and brown people are quite high. Certainly in India and in Brazil, to an obvious lesser extent in Russia, but to certainly a large extent here in the United States. You heard that report from Drew Griffin of CNN that I played. It was almost 4 minutes long. The report talked about Maurice Dodson, who was a black man, who died at the age of 51, as I said. But I looked up the website of West Oaks, the nursing home where he worked for 25 years. And what you will see on that website, and what I saw on that website, are black and brown faces, elderly faces, smiling into the camera at you. They are you. That's the story that doesn't get told. Drew Griffin does outstanding investigative reporting. He's one of the best around. What I wanted to hear about was the makeup of that home that Maurice Dodson worked in. And I would hazard a guess that it is a predominantly black home, nursing home. The very places where people are supposed to be taken care of are the very places where there is mass death. Hospitals, nursing homes. And as you heard in that report, Debbie Berkowitz, who used to be at OSHA, the Office of Safety Health Administration, OSHA, in government, said that there aren't any real binding regulations in place. They are voluntary regulations. These care homes, these nursing homes, aren't obligated. It's a voluntary thing. So these guidelines are not binding. And this is a product of 40 years of deregulation, libertarianism, neoliberalism. These policies have been the driving force behind the destructive aspects of these nursing homes and these hospitals. These policies are the engine of death that has been pointed at black and brown communities. These policies have really accounted for why, along with the institutional racism, centuries of it, we have these disproportionate numbers of black people and brown people dying from this virus. There is no question about it. The systemic aspects of this are very underreported here in the United States, as they are in the United Kingdom, as they are in India, as they are in Brazil. There is no question that the policies of Reagan, the policies of Thatcher, and the policies that other countries adopted over the next 40 years of libertarianism and neoliberalism have been chiefly responsible for the neglect, for the lack of oversight, for the lack of any kind of regulation. And that is why you have what you have now. Many black people dying. This is the black and brown disease. This is the genocide of black people and brown people again. This is the 21st century genocide of black people. This is also true of Native Americans, who once again are experiencing this hell. And I think they need to have more coverage, but not just more coverage. We now need solutions. We now need governments who are going to be responsible, which is where you and I come into the equation. Here in the United States this November, we have a choice to make. It's a very easy choice. Some people would disagree with me. But in terms of dealing with an infrastructure that has been shot to all hell, and one person who has been very much a part of doing that in his last 3 years of office, plus 3+ years, and another person who will certainly take us away from that kind of tyrannical, dangerous place, even if his policies are not spectacularly great by a long shot. I think the choice is very clear. I think the choice is very clear. One of the things that the media this week did not report was that Donald Trump is signing, or did sign, an executive order, or he certainly said he would sign an executive order ordering all government agencies, whether it's OSHA, whether it's the EPA, whether it's anybody else, to disobey and suspend any regulations in their organizations. In other words, Donald Trump this week, while we were all talking about the voting by mail, while we were all talking about him drinking hydroxychloroquine, while we were all talking in the media about, will he wear a mask or won't he? Signed an executive order telling all the government agencies not to abide by their own regulations. FDA, pay no attention to meat inspection laws and rules that you've devised. EPA, pay no attention to the rules that you have, the dwindling regulations that you have left since you've gutted them yourselves with the people you've put in charge. OSHA, ignore safety laws for work employees. And I could go on and on of all the government agencies. That is the thing this week that happened here in the United States. And yet it was not reported, certainly not on television, on the cable news media. These are the things that don't get reported, that must get reported. This genocide, this Black Death, this Brown Death, this genociding once again of Native Americans is due to institutional racism, governmental malfeasance and criminality, and 40 years, if not more, quite frankly, of neoliberal and libertarian policies, and a toxic brand of capitalism and deregulation that has resulted in governments getting away literally with murder. Nursing homes do not have the equipment that they need. Nurses are on the front lines. Black and brown people are the care workers in the United States and in the United Kingdom and elsewhere. When you walk the street and you see an elderly person, be they white, be they black, be they Asian, the chances are that you're going to see either a black or brown person taking care of them. That is the greatest possibility. You may get Asian people as well taking care of Asian elderly, because that is something that Asian groups are more apt to do because of a tradition of respecting their elders. And the African countries do a lot of this as well, very much placed on elder respect and a whole tradition of respecting the elderly. But we live in an America that doesn't do that doesn't care about people who are older, who discards people after they turn 35, if they're women, and thinks that 50 and north of 50 is ancient history. I'm going to read you just a portion of a story from May the 21st from the New York Times. It's called "The Striking Racial Divide in How COVID-19 Has Hit Nursing Homes." Homes with a significant number of Black and Latino residents have been twice as likely to be hit by the coronavirus as those where the population is overwhelmingly white. In the suburbs of Baltimore, workers at one nursing home said they were given rain ponchos to protect from infection. 27 employees at the facility, where most residents are African American, tested positive for the coronavirus. One of many Black residents of a nursing home in Belleville, Illinois, died in April amid a coronavirus outbreak. But his niece complained that he was never tested for the virus. In East Los Angeles, a staff member at a predominantly Latino nursing home, where an outbreak emerged, said she was given swimming goggles before professional gear could be obtained. She later said she tested positive for the virus. COVID-19 has been particularly virulent towards African Americans and Latinos. Nursing homes, where those groups make up a significant portion of the residents, no matter their location, no matter their size, no matter their government rating, have been twice as likely to get hit by the coronavirus as those where the population is overwhelmingly white. More than 60% of nursing homes where at least a quarter of the residents are Black or Latino have reported at least one coronavirus case, a New York Times analysis shows. That is double the rate of homes where Black and Latino people make up less than 5% of the population. And in nursing homes, a single case often leads to a handful of cases and then a full-fledged outbreak. The nation's nursing homes, like many of its schools, churches, and neighborhoods, are largely segregated, and those that serve predominantly Black and Latino residents tend to receive fewer stars on government ratings. Those facilities also tend to house more residents and to be located in urban areas, which are risk factors in the pandemic. That's just a portion of the article. I would actually say that these homes being located in urban areas are not the problem. The problem is that those urban areas have been completely neglected and disregarded by governments throughout time. and that the systemic racism and the institutionalized racism directed at urban areas, quote unquote, that cause them to be urban in the first place are what are the risk factors that make those people in those areas called urban areas at most vulnerable peaks. Urban areas are not the problem. The lack of care and the lack of help given to those areas by the government is the problem. The institutional racism is the problem. The racial discrimination is the problem. The fact that, as you heard in that report, an administrator was calling and begging Donald Trump to give masks and PPE to these nursing homes. But instead he gave them all to these hospitals and gave nothing to nursing homes. That is a problem. This article I've just read from is an extensive one. I urge you to look at it. I will read one more piece of it. Eric Russell, who moved his mother to a different nursing home in the Chicago area after she tested positive for the virus, said the prevalence of cases in homes with more black residents was alarming and needed to be more widely understood and examined by the authorities. Quote, "Nobody gave a damn about the black people dying at a higher clip," Mr. Russell said. At his mother's former nursing home, Villa at Windsor Park on Chicago's South Side, where most residents are black, at least 121 residents and employees have been infected and 24 people have died. The coronavirus has been infecting and killing people of color at disproportionately high rates in the United States, data has shown, and officials in the nursing home industry say that the situations playing out inside homes largely reflect the circumstances unfolding outside their walls. Quote, "Typically what occurs in the general population is mirrored in long-term care facilities," said Dr. David Gifford, Chief Medical Officer for the American Healthcare Association, which represents the industry. Nursing homes within communities that have been hotspots for the virus are more likely to see outbreaks, he said, especially in large facilities with lots of employees coming in and out. Small nursing homes, which are disproportionately occupied by white residents, tend to have fewer outbreaks than larger facilities, and urban nursing homes have more outbreaks than suburban or rural ones. And that stands to reason, because when you do have large groups of people or people confined in a small space, the more of an incubator that becomes. It's the same thing with the Princess Cruise ship that was stranded off the Bay Area, San Francisco Bay. That cruise ship had thousands of people on it, and there were multiple infections, and there were quite a few deaths, to say the least. There was an article in Bloomberg that went into detail about what happened on that cruise ship. So imagine what's going on in these nursing care facilities, especially the ones that are in black and brown areas, especially the ones where hundreds of people, dozens and dozens of people are going back and forth daily. And you've got elderly people in there who are at grave vulnerability, from this virus. It's the same thing with detention centers that have a lot of predominantly black and brown and native people in them, Native Americans. And people reluctantly being released. This is unreal. Governor Cuomo, who's been made out to be this hero, has been absolutely shocking in his contempt for the detainees, the prisoners, the black and brown people that are behind bars or detained. He was pressured to let them go. And again, his 2020 budget cuts Medicaid, which really hurts predominantly black and brown people and poor whites. When I return, a couple more things about what is the 21st century black and brown genocide. Welcome back. There are just a couple of things I want to say. The Guardian today has a story, heartbreaking story, but it must be told and it must be read. The title is Inundated and Overwhelmed: Black Undertakers Struggle Amid Pandemic. The story is written by Dax Devlon Ross. May 22nd, 2020. The subtitle, Black-owned funeral homes were already in decline. Can they survive COVID-19? And what the article talks about is the pressure, the extreme pressure on these black undertakers who were in a lot of trouble in terms of financing, in terms of survival before this coronavirus pandemic came along. Now they are in extreme pressure and in real jeopardy. How do you prepare the dead if you are in a situation where you are struggling to survive as a business, as a very place to house people, to protect and provide a respectful preparation for death, for burial, a respectful. This article reveals the struggles, and it's really painful to read, but it's got to be read. I will read a couple of portions of it. The article starts with Shawnte Harvell, and he is a 38-year-old black man who has a funeral director business, and he is embalming people, and most of the people he is embalming these days are black people. And he has a funeral home in Elizabeth, New Jersey. As I said, he's 38 years old. And he says that every funeral home in this area in New Jersey has become a sweatshop. Elizabeth, New Jersey is a largely Latino and black working class suburb. So this article talks about the black funeral homes, some of which are on the East Coast that they mention in this story that Dax Devlon Ross writes of. These are mom and pop operations too, and these typically serve people who are black and Latino or who have low incomes. There are less than 3,000 black funeral homes in the United States. But I can assure you there are certainly not less than 3,000 black people dead in this country due to coronavirus. And the government has not helped them at all. This has been something that I'm going to read again. I read a portion of this to you so that you can get a sense of just how taxing this all is and how serious this all is. And I don't think, again, apart from the CNN report that I played at the beginning or nearer the earlier portion of this podcast, I don't think that people really do get a sense of just how, at least some people. And quite frankly, I think this goes back to what I've been writing about lately, where there is, at least in my observation here in San Francisco, a certain sense of cavalierness amongst some white people who happily, gleefully walk around without any mask on. I know people have to live their lives, but I think this is about respect. This is also about respect and showing respect to those who've passed away, to their memories. You've got 100,000 people in the United States dead from this virus. And I'm sure they didn't die for you to be blissfully unaware and carefree. We're living in a different time, even though the circumstances are the same and have been for centuries. And I think there's a lot of privilege and there's a lot of arrogance and there's a lot of entitlement and there's a lot of selfishness. And zero empathy. A very sociopathic fervor. Amongst people who walk around with no mask on, taking the lead of the guy in the White House. And that is the very White House as have subsequent White Houses before it, I should say previous ones, who have not shown the kind of care and attention to this issue of black health in this country as they should. We're supposed to be a country that provides all these riches, but look at what we do. You define a government, you define a nation by how it treats the most vulnerable people within it. And right now, America has given a damning judgment on this government and on this nation as to how it treats the most vulnerable within it. When Robert Robinson fell ill in March with a presumed case of COVID-19, paramedics took him to Detroit's Sinai Grace, the hospital that made national headlines in April when pictures of stacked body bags in vacant hospital rooms were leaked to the media. Robert's wife, Gwen, was already on a ventilator at Providence Hospital in suburban Southfield, Michigan. On 28th of March, Robert died. 3 days later, Gwen did too. Their bodies were sent to Stephen Kemp's funeral home in Southfield. More than 2 weeks later, their bodies were still in Kemp's refrigeration unit, alongside 47 others. All 49 bodies were African American, all believed to be victims of COVID-19. In mid-April, Shante Harvell, who typically does 15 funerals a month, had 58 bodies in his care and another 16 awaiting retrieval at nearby hospitals. Before the pandemic, he could arrange burials in a matter of days. Now he's telling families he has served for years that funerals will take weeks or even as long as a month. A lady recently called me and said, "Sean, I've been in this house with my mother for a whole day and a half because I can't find a funeral home that can accommodate me." Harvell couldn't turn her away. "I maxed out and I just had to take her," he said. At the end of the long day and night, Harvell heads home to his own family. But before he enters the house, he takes off his clothes, sprays them down, and leaves everything in a bag by the door. He eats and tries to watch something on television that will distract his mind. But it's impossible to shake off the day when he knows it's all just waiting to repeat itself tomorrow. "Sometimes I just want to bust out and cry," he says, thinking about what he's able to offer to families and what he can't. We're inundated and overwhelmed. I would urge you to read that story, which I just read parts of, in today's Guardian. It's written by Dax Devlon Ross. Friday, May 22nd, 2020 is the date of the story. The title, Inundated and Overwhelmed, Black Undertakers Struggle Amid Pandemic. I would also urge you to go to covidtracking.com. That's COVID, COVID, tracking.com, to look at what the COVID Tracking Project is doing. It's at the Atlantic in conjunction with Ibram Kendi's Anti-Racist Research and Policy Center. And together, they have come up with the COVID Racial Data Tracker. What that tracker does is track the deaths and the infections of people who are black and brown and Native American, and I believe also Asian as well. Certainly, black and brown people are being tracked in this racial data tracker. That is at covidtracking.com. Thanks for listening to The Politicrat. I'm Omar Moore.